Hi, I'm Miranda. This is Mr. Jones. I'm going to be doing a eyes, ears, nose, and throat exam today. I do not have a real otoscope, however, so I'm going to be using this just for demonstration. How are you feeling today, Mr. Jones?
Fine.
Any eye pain?
No.
Alright, so first we're going to start with the eye examination. First you can test for PERLA, which is pupils equal reactive to light and accommodation. So you are going to first have the patient just look straight, and then we're going to do his right eye first, and you're just going to come into the side with the pen light to make sure that his pupils constrict. And then we will start this way. Next, we are going to have him look at an object, so he can just look up at the corner, and then you will do the same thing. Okay, now look up again, and the same thing. Then you can also, to check for some shaking and abnormalities in the eyes, you can also do the cover and uncover test, where you have a patient focus on an object. You cover one eye, have them do that 3 times, and then you'll switch and do the other eye. If the eye does shake or have any movements during this, it can indicate weakness of the eye muscle. Next, we are going to do the ear assessment. So, when looking in a patient's ear, you're going to have an otoscope with a light. If it is an adult patient, you are going to pull the ear up and back to look in. If you're dealing with a pediatric patient, you'll just pull the ear directly back. This just creates an opening directly into the ear canal so you can visualize better. So we'll pull the ear up and back. You will put the otoscope directly into the ear, and then you'll look. You're checking for ear infections, any redness, any swelling, any grayness in color. And we'll go to the other side. Up and back. Both ears look good, no abnormalities. Next, we will go to the nose. Usually you could just use the otoscope also for the nose, but so that I can see, I'm going to use the pen light. Can you tilt your head up? Look in the first side. You're going to be checking for any redness, any swelling. You also want to make sure that there's no discoloration. It should be pink and moist mucous membranes. You can also check for any deviations of the septum. Both sides look good. Any nose pain?
No.
And just feel down the nose. Next, we're going to check the throat. So you'll need a tongue depressor. When assessing the throat, we'll check for any swelling. Some patients may or may not have their tonsils. You can also check for any lesions in the mouth. You can also do a strep swab if you think that the patient might have strep throat. Go ahead and open. Stick your tongue out. Say ah. Tongue down. Looks good. Alright, next, we're going to just feel down the neck. You can feel the lymph nodes. Make sure there's no swelling. And then next, I'm going to have you stand up. And you can stand behind the patient to feel the thyroid gland. Stand up. you're just gonna start first. You're going to deviate and then try to feel the thyroid gland just to make sure that it's not enlarged. Alright, go ahead and have a seat. Any questions today, Mr. Jones? Any questions?